The Philippine Department of Health confirmed a positive novel coronavirus 2019 case, saying that the patient was a 39-year-old Chinese woman from Wuhan who is now considered asymptomatic. Let's listen in.
And today, the DOH is confirming that a 38-year-old female Chinese patient under investigation, or PUI, is positive for the novel coronavirus 2019 nCoV after her lab results arrived today from the Victorian Infectious Disease Reference Laboratory in Melbourne, Australia. The DOH, however, continues to guarantee the public that all necessary precautionary measures are being taken to halt the spread of the virus. The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25 after experiencing mild cough. She is currently asymptomatic. So let me repeat. She is currently asymptomatic, which means she has no fever and no other signs and symptoms suggesting illness at this point. I assure that the public that the DOH is on top of this evolving situation. We were able to detect the first confirmed case because of our strong surveillance system, close coordination with the World Health Organization and other national agencies, and the utilization of DOH's decision tool or the evaluation assessment tool. We are working closely with the hospital where the patient is admitted and have activated the incident command system of the said hospital for appropriate management, specifically on infection control, case management, and containment. We are also implementing measures to protect the health.
The DOH also said that it is now working closely with the hospital where the patient is admitted. Secretary Duque said that in all, there are 29 patients under investigation. 18 of them are in Metro Manila, 4 in Central Visayas, 3 in Western Visayas, 1 in Mimaropa, 1 in Eastern Visayas, 1 in Northern Mindanao, and 1 in Davao. Secretary Duque said that the Interagency Task Force on Emerging Infectious Diseases is coordinating with all the local and international agencies concerned. It's also in, quote, constant coordination with officials from all ports of entry for stricter border surveillance.
The Bureau of Quarantine remains on high alert and is in constant coordination with authorities from all ports of entry for stricter border surveillance. DOH assures that its health facilities are equipped and prepared to receive and care for PUIs, as well as confirmed 2019 nCoV cases. DOH has recorded a total of 29 PUIs, 18 in Metro Manila, 4 in Central Visayas, 3 in Western Visayas, 1 in Mimaropa, 1 in Eastern Visayas, and 1 in Northern Mindanao, and 1 in Davao. 23 PUIs are currently admitted, and 5 have been discharged, but are still under strict monitoring. DOH also reported 1 PUI mortality yesterday. We did that. Finally, I urge the public to stay calm and remain vigilant at all times. Let us continue to practice good personal hygiene and indeed adopt healthy lifestyles. Thank you.
And we are looking at the places where they've been to in Cebu and in Dumaguete. Once we have seen or we have the list of these places, then we do the contact tracing. For the plane, we do the rules of 4. That means we need to identify passengers, 4 passengers front, 4 passengers at the back and 4 passengers on both sides. Then we contact these passengers and advise them accordingly. But for the community, we are looking at the establishment where they stayed and advise the establishment owner to identify the employees that had been in contact with the patient, and from there do the mandatory quarantine to observe them if ever they will manifest any signs and symptoms of respiratory infection.